BA2, it's also called the stealth variant. It's basically the original Omicron was the BA1. This is the new version. It's the mutated version.
As many New Yorkers took off masks and took in spring-like air today, a new health concern is looming.
I don't think we need to panic just yet, but I do think that we have to take the proper precautions, follow the common sense and the CDC and Department of Health guidelines in terms of wearing a mask indoors.
Dr. Pavel Gozenput is a critical care and infectious disease doctor who also runs an ICU unit on Long Island. He's seen the worst of COVID-19 in 2020.
I'm getting goosebumps right now. That's how bad it was in the ICU setting.
And he has been seeing fewer people on ventilators and more people going home. But the BA2 variant is spreading fast. According to the CDC this week, it makes up nearly a quarter of new COVID infections across the country. Here in New York, COVID cases more than doubled this week, with the positivity rate jumping from 1.45% Monday to 3.75% Tuesday.
We're seeing some early data on the fact that there's certainly an upspike, and it's more prominent in folks who are not vaccinated and who are not boosted.
He says he hasn't seen a spike in COVID hospitalizations this week. Residents who live in Jackson Heights, one area in Queens heavily affected by COVID, aren't too worried.
We've been through that. We still survive. So I don't know. I for myself, I don't have any concern.
Are you concerned?
Not really. Not now.
Why?
Because I'm very safety with my mask, number one, and I got my three vaccinated.
And in Queens, where residents struggle to get testing and vaccination sites,
I'm concerned because then it means more and more boosters again, more and more vaccines.
yeah.
And, we want to go back to our ways, our livelihood,
As doctors study the new BA2 variant to see how it's transmitted and how quickly it spreads, they say the key to stopping all COVID variants is the vaccine.
More time that we take getting vaccinated and getting boosted, we're giving the virus more of a chance to continue to mutate and form these new variants.